Hello, listeners. My name is Gary Hickey, and I work for the National Institute for Health and Care Research, an organisation based in the UK that funds research both in the UK and indeed globally. And welcome to our podcast series, Spotlight on Community Engagement and Involvement, Leaving No One Behind, exploring how we involve and engage people and communities in health and social care research, with particular focus on those who are most marginalised and vulnerable. This is the third episode in the series, and today we'll be focusing on engaging and involving mobile, stateless, and displaced communities. And I'm delighted to be joined by three guests who tell us all about these issues. And so it's my pleasure to introduce, first of all, Kay Nathan, a research manager based at University of Malaya in Malaysia. Hello, Kay.
Hello, Vearey.
Fantastic. And also Farzana Khan, Chief Executive Director and the founder at Fasiuddin Khan Research Foundation, which is a social enterprise in Bangladesh, which aims to improve healthcare access and quality in Bangladesh. And I'm sure I pronounced the name of that incorrectly, Farzana, but please do put me right. And hello, Farzana.
Hi, Gary. It was absolutely correct. The pronunciation was absolutely right. Thank you.
Fantastic. That's pleased me no end, Farzana. Thank you so much. And indeed, we also joined by Joe Vearey, who's Associate Professor at the African Centre for Migration Society at the University of Witwatersrand in South Africa. Hello, Joe.
Hi, lovely to be here. Thank you.
Marvellous. Thank you very much. So I'm going to just give you a chance to introduce yourselves a bit more. That was a very brief introduction from myself. So let's start with Kay. And could you tell us a little bit about yourself, your research, and how you started working with marginalised and/or vulnerable communities?
Thank you, Gary. Thank you so much. So basically, I'm a research manager in National Institute for Health and Care Research, Global Health Research Unit on Respiratory Health, RESPIRE study. So in terms of our research focuses on developing a clinical algorithm for diagnosing smear-negative pulmonary tuberculosis, particularly in settings with limited resources. In Sabah, we engaged with stateless population who often face significant barriers to accessing healthcare due to their legal status. So these communities are frequently marginalized and endure stigma, which can prevent them from seeking treatment for diseases like tuberculosis. So a significant number of individuals within this population are also illiterate, so which further complicates their ability to understand health information. So my involvement began with RESPIRE study, where I collaborated with the Sabah team on community engagement activities. We organized outreach initiatives to raise awareness and understand the unique challenges these stateless individuals face. So during our visits, we aim to reduce stigma and dispel harmful misconception about tuberculosis. So fostering an open dialogue that encourage this individual to share their experiences and concerns. So to address literacy issue, we adapted our healthcare messages into pictorial form using media that resonates with them, such as short videos featuring local colloquial slang. So that is a brief introduction about our initiative in Sabah. Thank you, Gary.
Thank you, Kate. And we'll dig down into that a little bit more in a moment. Farzana, do you want to tell us a little bit more about yourself, your research, and how you started working with marginalised and/or vulnerable communities?
Thank you, Gary. Let me first extend my grateful thanks to NIHR to have me in this podcast. And I also warmly welcome the audience into this session. Actually, I'm a palliative care physician from Bangladesh. So under the RESPIRE program at the University of Edinburgh, we are conducting a multi-country feasibility study on pulmonary rehabilitation for patients with chronic respiratory diseases across low-resource settings in Bangladesh, Bhutan, and Pakistan. Our specific study area is Cox's Bazar, Bangladesh, a region that is not only low-resourced but also exceptionally vulnerable. Cox's Bazar, located at Bangladesh's southernmost part, bordering Myanmar, hosts the sprawling Rohingya refugee camps, one of the world's largest and most rapidly growing refugee settlements. Following the August 2017 military conflict in Myanmar, over 1 million people fled to the area and now live across 34 camps. At the height of the crisis, hundreds of NGOs were providing healthcare services in these camps, yet palliative care was notably absent. During a 2-day medical camp I joined in October 2017, we saw over 600 patients, most of whom presented with acute respiratory symptoms, fever, diarrhea, pain, cough, etc. As a palliative care advocate, I quickly noticed that patients needing palliative support were not among those seeking care. When I inquired, locals explained that many cancer patients and others in need of palliative care were too debilitated to travel or lacked support to reach the clinics. With this insight, we realized the gap in care for these individuals. Drawing on the experiences of the Fasiuddin Khan Research Foundation, FKRF, in providing community palliative care to displaced populations in Dhaka's urban slums, we decided to expand our services to include refugees in Cox's Bazar. This effort has become a part of our mission to bridge critical gaps in healthcare for those most in need.
Thank you, Farzana. And Joe, can you tell us a little bit more about yourself, your research, and how you started working with marginalised and/or vulnerable communities?
Sure, thanks. So I've got a background in public health. My PhD is in public health. And as part of that work, I was looking at the intersections between migration, HIV, urban governance, and informal settlements, so informal living in Johannesburg. And at this point, it was working with people who had moved from elsewhere within South Africa. And it was really about exploring the kinds of risks and prevention strategies, that would be the most appropriate around HIV and STIs. And through the research and through the various pieces of the work, really recognizing that we are not effectively and efficiently engaging with issues to do with movement. So the NIHR program that I'm part of is a global health research group known as GEMS, within which we're looking at ways in which the relationship between gendered violence and poor mental health in precarious contexts where different migrant groups are found, and exploring ways in which to better understand that in order to intervene and develop interventions that may address those issues. In the Southern African partners, it's South Africa and Zimbabwe. We're working with colleagues also in India and Cambodia.
Thank you, Joe. So you've all given very good answers there about your background, and you all referred to sort of various marginalised and vulnerable communities. As you know, the theme of this podcast series is about leaving no one behind. And I'd like to start with you, Joe, what does leave no one behind mean to you?
There's increasing recognition at the global level about the importance of understanding the relationships around migration, displacement, and health. And linked to that, there's been sort of a clarion call around, there's no health without migrant health. And the recognition that by leaving different groups behind, nobody is benefiting. We need to ensure that everybody is involved and on the way. And we know that because health interventions in particular, but other SDG-related activities do not necessarily engage with the movement of people. And as a result, people get left behind. And just one, I think, important and relevant way of thinking about this is when we want to think about, COVID and the pandemic and trying to roll out vaccination. And obviously, a whole range of issues around inequities in access to vaccines. But in a context like South Africa, how do we provide and develop safe ways for people with different documentation statuses to access vaccination? Because if we only vaccinate some of us, none of us benefit. And I think that remembering the public health reasons in leaving no one behind is very important.
Thank you, Joe. Farzana and Kay, what does leave no one behind mean to you?
For me, leave no one behind means that every individual, no matter who they are, where they live, or what illness they face, deserves access to the best possible opportunities and care.
Fantastic. That's very succinct and full. Thank you, Farzana. Kay, would you like to add anything to that?
Yes, Gary. So to me, leave no one behind is a very powerful commitment. So basically to ensuring that everyone, regardless of their background or circumstances, has access to the healthcare they deserve. So it speaks to the very core of our humanity. So acknowledging that each person's life matters in the context of our work, it means tirelessly addressing the barrier that marginalized groups, such as the stateless individual in Sabah, Malaysia, face. They can seek the treatment and care they need without fear or hesitation.
Thank you, Kay. It's almost like a sort of a moral cause, very much so. And you touched on there, Kay, about some of the challenges, as indeed did you all. And could you tell us a bit more about the main challenges for engaging the groups with whom you're working in your research, and talk to us about how you've addressed these challenges?
So, engaging stateless community in Sabah, Malaysia has not been without its challenges. So, one of the most significant obstacle is the stigma and pervasive misinformation surrounding tuberculosis. So, there's a lot of myths that can grip individual with fear, such as idea that TB is untreatable or that only certain groups are affected. So, additionally, many stateless individuals are reluctant to seek help due to concern about their legal status. However, through open conversations and our community engagement activities, we strive to build trust and share accurate information.
Fantastic. Thank you. Farzana, have you got anything to add to that in terms of main challenges for engaging groups in the research and how you've addressed them?
The context itself is a barrier. The extreme heat and hilly surroundings in Rohingya camps makes participation physically challenging, reducing stamina and limiting engagement of patients or other participants also. And to address this, we conduct sessions in shaded areas, try to use portable fans or provide water, and keep sessions brief with regular breaks to ensure participants' comfort and sustained attention. And as you know, that building trust is another major challenge in the refugee camps. Like due to past negative experiences and concerns about external motives, many refugees may initially be reluctant to trust outside groups. So, establishing a continuous, transparent presence and collaborating with culturally aware facilitators, ideally from within the community or similar backgrounds, is essential. So, we made cooperative agreement with UN IOM, that is the International Organization for Migration. And this partnering with IOM allows us to include their trusted doctors, nurses, and community health workers who have long-standing relationships with the community. By clearly communicating research goals and community benefits, we work to build a safe, inclusive environment. And there is another barrier, that is language barrier and verifying literacy levels of the patients or other participants. So effective communication is really a barrier over there. So we use interpreters fluent in Rohingya language and incorporate visual aids, videos, and storytelling, and engage community leaders such as religious figures, majis, and teachers who can bridge understanding effectively. We believe that solutions are actually about creating circles of communication and taking action. And there is another problem in refugee camps, that is lack of incentive is a barrier. So with limited economic opportunities, so participation without compensation may pose difficulties. That's why we provide non-cash incentives, because in refugee camps, you cannot provide cash incentives to the participants. So we provide non-cash incentives such as food, transportation vouchers, or small health kits, which motivate participation within ethical and cultural guidelines. Even sometimes modest acknowledgements of participants' contributions can enhance engagement and motivation.
Thank you, Farzana. I mean, you mentioned a couple of things that are really of great interest to me. And one was trust, which I think is at the heart of any successful community engagement involvement. And the one, of course, was like the incentive stroke, the feedback given to people. And particularly with trust, because I think that's something that's very hard to build up, but very easily lost and very quickly lost. So something there isn't there about investing in time and investing in those longer term relationships rather than us as researchers zooming in and out of communities. I think that's really important. Joe, over to you. What are the main challenges that you've had of engaging the various groups you spoke about and how you've addressed those?
I think as others have indicated, and you've also raised, is, trust is a huge thing. And I think the importance of working with partners that as the kind of research team, as it were, ensuring that as part of that consortium, we have partners who are based in local context, and through them, really ensuring that they are directing us in the best way to engage, that they are involved in the development of the research process, that they are able to really provide input into processes, into best ways of engaging, but importantly, really being able to then translate that actively with different communities on the ground with whom we're engaging. And I think what we cannot underestimate is the amount of time, as you say, that this requires. And, some of us, the framing of slow research as a very specific approach, which is not suited to the ways in which, grant funding in many ways, but the importance of having that ability at the beginning of a program to slowly build those relationships, or be returning to ones that already existed, but you need to refresh them. Now, obviously, there's the context, and things shift and change. And in one of our contexts, for example, in the South African case, where changes in immigration legislation, in social attitude towards foreign nationals, increased levels of xenophobia, fear of the state by foreign nationals, for example, then shifts and pushes people into other spaces, pushes maybe people in less interested in engaging, whereas perhaps 12 months previously they were actively engaged in a program like a research and intervention program. They're being able to adapt to those changing contexts that are really the structurally driven contextual factors that we have no control over, communities have no control over. But how do we adapt and respond within those and ensure that we can undertake relevant, ethical, safe research that won't place people at harm?
John, could you tell us a bit more about that adapting to the changing circumstances? If you've got like an example of how you adapted to that changing landscape.
So I suppose one example would be that the location of our main research. I'm just going to talk a little bit about the South African context. The space where we are locating the South African research component is in an area that we as a research centre have a long history of working with. And it is incredible to see the difference between 2 years ago, 3 years ago, when you're developing a proposal, and the ways in which migration and the movement of people across borders is being viewed. It's always been a difficult space, but that's pushed people who are living and moving through those spaces, who perhaps have an irregular documentation status, have pushed them into different ways of living, ways of trying to seek work. So that has meant working with our local community partners through our local advisory group to really, who are the ones who are there all the time, working and supporting them in re-identifying what today a safe space looks like, which might not have been what we had anticipated several years ago. So just being able to adapt to that and being guided by our community partners is incredibly important, and being willing to listen to them and recognizing their expertise in that, and support to that process.
Fantastic, thank you. I mean, some real sort of themes that you're all bringing out, and I just jotted some things down. Obviously, adapting to changing circumstance environment is clearly important. Creating safe spaces, linking with existing organisations. Joe, that was something you said was really important. I think it came out from what Farzana and Kay were saying. Trust, and that involves time, invest in that, and developing those longer term relationships. And I think that they seem to be like core whenever we do these podcasts and talk to people. There seems to be some core things. I wonder, like, sort of building on that, if you could all give me some examples of some of the things that you've done in terms of your community engagement involvement activities that have worked in specific context. And as we were with Joe, I'll start with Joe.
So from the initiation of the project, and sort of outlined from the when we started thinking about building this group together to put a proposal together, it really was about how do we ensure that we are not sort of flying in and coming up with abstract research that doesn't have any relevance to a particular context. So establishing systems for building local advisory groups, thinking about then regional advisory groups that would look at a wider area, for example, Southern Africa, or perhaps a region of India, let's say, and using those different actors and their expertise and their connections and their experiences to also allow us to really gain different insights into different spaces. What I found very interesting was when we were working during our first community workshop in the South African context, and the number of people from all of the different organizations that are active in the space, how many people wanted to come and participate and who wanted to share. And we ran it as very much a workshopping space. But I don't think any of the team, including some of our main community partners, had realized just how many people were looking for a space to share their experiences of working with different groups. Whether it was about sharing frustrations, whether it was about sharing things that they'd found that had worked, but really saying, this is what needs to be done and how do we build that in? And we ended up shifting that into really thinking about a community advisory network rather than a group. And through that, then having several representatives who form that kind of more formalized group. But really being able to use those different people and their organizations, many of which are very informal, small community-led groups, and bringing everyone into these spaces to share, reflect, and learn together.
Fantastic. Thank you, Joe. Kay, can you give some specific examples of what's worked in terms of community engagement and involvement, and in what contexts?
Sure, Carrie. So it's just that we are currently in the process of monitoring and evaluating the impact of our engagement activities. So it is too early to draw a definite conclusion. But however, we have taken important steps toward raising awareness about tuberculosis within the community. So the one significant development is the recruitment of community volunteers from the group we engaged with. So these volunteers are crucial in identifying individuals with tuberculosis and helping to break down the stigma associated with this disease. So basically, to facilitate their effort, we have set up a WhatsApp group where volunteers can share information and support each other. So while we haven't yet seen measurable changes, these initiatives are laying the groundwork for a more informed community. So we remain hopeful that as we continue our work, we will witness increased awareness and more individuals feeling empowered to seek early treatment for tuberculosis. So that's from me.
Fantastic. And also, Kate, a nice final reminder that monitoring your community engagement involvement activities obviously is really, really important. For Farzana, have you got some examples of things that have particularly worked and in what context?
I think in our case, what actually works is a compassion. We use compassion as a practical tool, not as a nice idea or sentiment. So, in everyday terms, compassion might mean that having a good, nice feeling and to feel others people's feelings, but you just cannot feel other people's feeling. You have to care about their feelings. So that's what we try to do. And what we do, we design our activities that directly address the specific concerns of the patients and making engagement more meaningful. And we try to provide them holistic support. We address the interconnected challenges they face, like health, social, and economic issues, to provide comprehensive support. And I would cite an example, but that is a very, I would say, difficult example. Two patients were coming to attend our pulmonary rehab exercise. We have 5 centers, and in one of our centers, and they got a severe accident. And after the accident, one patient immediately died, and another was severely injured and was hospitalized. Later, he survived. So after that, what we did, we continuously connected with the families, and later on, while we visited their homes with actually our cultural things, like when we visit a patient who already died, with some fruits and other things. So we went there and gave solace to the family members, and the neighbors also came together over there. And we also gave commitment that we will bear a part of their expenditure that they have to spend in the hospital, and that's a very, very big amount. So this was not a nice example, but that is compassion to that is compassion means to us.
Thank you. Thank you for sharing that, Farzana. Obviously, you've all worked with an engaged community as part of your research. I'd be interested to know what you think the impact has been on them.
It is still too early for us to make a definite conclusion about it. But in terms of how it has benefited us in for our research, I would say that, involving this stateless community has enriched our research in a way that we never anticipated. So their insight into the cultural and logistical barrier they face have been invaluable. So allowing us to basically tailor our approach to their real world experiences. So this collaboration not only enhances the relevance of our work, but also reinforces the notion that we are in this together, striving for a healthier future for all.
Brilliant. Thank you. Fantastic. And in many ways, you sort of started to answer my next question. So I'll hand this one to Farzana. How has including such groups benefited your research?
Actually, involving refugee groups in research helps us understand their needs better. So their unique insights provide valuable information that improves our findings. Although we are in the midpoint of collecting data and we haven't analyzed those, but so far, whatever we did, we have found that their insights are really valuable information that is going to be improved our findings. And by hearing their first-hand experiences, we can identify specific challenges and their health behaviors, allowing us to design truly effective and culturally appropriate interventions. So we try to be inclusive as I said, that building trust, and this has encouraged long-term engagement with them, and leading to better data quality, and new discoveries might come that may enhance our research. So by empowering the participants and addressing the barriers they face, we are trying to create a more ethical and community-driven approach that offers practical solutions that can influence also health policies later on. Ultimately, including these refugee groups not only improves the quality of our research, but also strengthens community resilience, ensuring that our work has a meaningful and lasting impact.
Thank you. Hey, Joe, have you got anything to add about how including these groups has benefited your research?
I think the one thing really is about a willingness to recognize that we are entering spaces we don't know, really, even if we've worked in these spaces. And I think the importance of really being confident and okay with the fact that you are not the expert in these spaces. And the knowledge held by the people you're working with is important, and it must be recognized. And, ensuring ethical practices have been mentioned that ensures that we're not, we are addressing concerns around sort of, knowledge politics, really, and thinking about extraction of information versus ways of supporting information being curated in different ways that benefit everybody. And for me, that's a really important sort of approach that over the years, you always have to relearn it in different spaces, but really trying to ensure that you foreground that in any approach to research.
Fantastic. I've got one last question, a quick fire question for each of you, and I'll start with Kay. What one piece of advice would you give to those people in engaged communities on how to be inclusive and leave no one behind?
I truly echo what Farzana said. So I would say it is crucial to build trust through engagement and understanding. First and foremost, take the time to really listen to the specific misconception and concerns within the community. So it's amazing how much you can learn just by having those conversations. Addressing stigma directly is key. Open conversations allow people to share their fears and clarify any misunderstanding. So it is important to create a safe space for dialogue where everyone feels heard. On top of that, collaborating with local healthcare personnel and community leaders is vital, as they can help ensure that your messages are relevant and relatable. So use simple language and relatable examples in your communication. And for those with low literacy, incorporating visual aid can make a huge difference. Lastly, maintaining a consistent presence in the community is essential. So being there regularly, fostering trust, and encourages ongoing dialogue. When people see that you are genuinely invested, they are more likely to engage and share their thoughts.
Thank you. Farzana, have you got anything to add to that?
So I would say that vulnerable settings matters, and marginalized population also matters. So try to be compassionate, be inclusive, listen and be open, and encourage participation. That's how we'll be able to leave no one behind.
Thank you, Farzana. And Joe, what advice would you give to those engaging communities on how to be inclusive and leave no one behind? Have you got anything to add to what Kay and Farzana?
One of the main things I would say is, and in some ways it's a very obvious thing, but is really respecting people's time and availability and interests. Is this something that somebody is interested to invest time in? If I'm moving through somewhere, if I'm living in a precarious space, I've probably got lots of priorities in my day, and that might not be participating in research. So how do I learn from that in order to reconsider approaches that would allow people to be involved and learn from them about what types of approaches could be more efficient and effective. Thanks.
Thank you. And thank you, Joe. Thank you, Kay. And thank you, Farzana. We're going to close the podcast here. And a huge thank you from all of us to you, the listener. Please do share the podcast, post it on X or Twitter, as it's called, and tune into other episodes in this series, which can be found on our website or wherever you listen to your podcasts. And please do let us know what you think by sending an email to social.media@nihr.ac.uk. And finally, a reminder that the NIHR MESH online course, an introduction and practical guide to community engagement and involvement in global health research, is now available and it's free to everybody. For more details on that, please visit the Global Health Training Centre website or visit www.nihr.ac.uk and search for community engagement and involvement, and you'll find the course in the resources section. And so that's all from us. So thank you very much again for listening, and please do enjoy the rest of your day.